delighted to be part of the Emerging Voices 2012, and I would like to thank the organizers of the program for this opportunity that they gave me. My name is Namusoke Magongo, a pediatrician from Uganda. I work with Management Sciences for Health STAR-E project that stands for Strengthening TB/AIDS Responses in the eastern part of my country. We conducted a study to see how a health systems intervention contributes to reducing loss to follow-up of HIV-exposed infants. In Uganda, the pediatric HIV program continues to lag behind the adult care and treatment program. And one of the biggest challenges that we face is retaining the children that we enroll at the clinics in care. We've designed good strategies to ensure that we get HIV-exposed infants as early as possible in care, but retaining them is a challenge. The theme of the Global Health Symposium on Health Systems Research this year is universal health coverage. In my opinion, if universal health coverage is to be meaningful, then we must ensure that we retain all the infants that we enroll in care, especially in the context of HIV, where HIV-exposed infants are continuously taking their ARV prophylaxis until we finally establish their HIV status. Uganda is a low-income country, and at the moment we do not have the capacity to have computerized systems in the rural areas to help health workers track infants who are missing their appointments. We are also working in a healthcare system that is human resource constrained, where the doctor to patient ratio is 1 to 15,000. We conducted our study at Busiyu Health Center 4, and before the study, the facility was experiencing a high rate of loss to follow-up of HIV-exposed infants attending the clinic. If you enrolled infants today, 3 months down the road, half of them would be lost to follow-up. So we did our study at this facility to help improve on this. We followed up 28 infants enrolled at the clinic of HIV-exposed infants from the month of October to December 2011, and we followed them up for another 3 months to see how many of them would still be in care after the introduction of our intervention. That's the exposed infant register, and before our study, a health worker would have to look at several pages of this register in order to identify an infant who has missed his or her appointment. It would take a very dedicated health worker to do this kind of thing because they are few with many patients. So we needed very innovative ways that can help the health workers easily identify infants who are missing their appointments so that they can be followed up as soon as possible. We rolled out the use of the appointment book, which has 5 columns: the date of appointment, the patient name, the clinic number, the purpose of the visit, and where you note if the patient has kept his or her appointment. And by just looking at this book, you are easily able to pick out who has not attended or kept the appointment. We had to train health workers in the correct use of the appointment book, because initially they were using it as a daily attendance register where you record everyone who is coming to the clinic consecutively. But the correct use of the appointment book is that you record an infant under the date of the next scheduled appointment visit. So this helps the health workers in such a way that before they even begin their clinic, they know who they are expecting, how many they are. They can prepare the medicines and retrieve the files early, and at the end of the clinic you're able to pick out who has missed their appointment. With the correct use of the appointment book, health workers were now finding it very easy to generate lists of infants that they need to follow up. These lists were handed over to expert clients in Uganda. Expert clients are people living with HIV who have gone through some form of training so that they help health workers with triage, health education talks, and following up people in the communities. We facilitated them with a transport refund and a lunch allowance, and they would go out in the communities to follow up these infants as soon as possible. Of the 28 infants that we followed up, 10 kept all their appointments, 18 missed at least one appointment, 6 infants completely got lost to follow up, and 12 of them returned in care after the home visits And at the end of our study, 79% of the infants were still in care. What did we learn from our study? We learned that in Uganda, where health workers are usually reluctant to take on another tool, they embrace the appointment book eagerly because they saw the added value to their work. I cannot emphasize any more or much more the need to continue using the community resource persons, in our case the expert clients, who are very useful, especially in our kind of healthcare system, or we have few health workers with so many patients. In conclusion, in resource limited settings, and I know not only in Uganda, where there are no computerized systems, the use of an appointment book is useful in identifying infants who have missed their appointments, initiating immediate follow-up. And immediate follow-up here is very important because it makes a big difference. I would like to acknowledge our donors, PEPFAR USAID, Management Sciences for Health, the lead organization in this project, the STAR team, health workers at the study site, and the participants in the study. I believe that with the positive steps that we are taking to ensure that the HIV-exposed infants are retained in care, and especially in this era where we're talking about virtual elimination of mother-to-child transmission of HIV, I know that this is going to go a long way in contributing towards the success of the PMTCT program in our country. Thank you very much.